right, good morning, everyone. We'll go ahead and get started now. It's 10 o'clock. So good morning, and thank you for joining today's webinar regarding the CalMedForce review for our 2018-2019 Year 1 awardees. My name is Robin Simpson, and I'm the CalMedForce Program Director at Physicians for a Healthy California. My colleagues and I hope to answer all your questions today about the annual review, which is a requirement of the CalMedForce grant. We have a lot of information to cover in today's webinar, and we'll have an opportunity to answer any of your questions that you may have at the end of the slideshow. If possible, please hold your questions for the end. All participants will be placed on mute during today's webinar. You may submit questions through the chat function, and our team will monitor the questions and answer all questions at the end. Please note we are recording today's webinar. It will be emailed to all awardees and posted to PHC's website by the end of the week. All right, here's our agenda for today's webinar. We will welcome you, and of course I introduce myself. We'll introduce my team as we go through the presentation as well. Talk a little bit about governance, an overview of what the annual review consists of, and then we'll go into depth on each of those sections, which are the cover page, the annual program invoice, and the program assessment. And we will talk about next steps, and of course answer questions at the end. And we always like to start with the CalMedForce mission. And we are committed to growing a diverse physician workforce by supporting, incentivizing, and expanding graduate medical education in California. Our goal is to grow and strengthen the physician pipeline to meet the demands of California's growing patient population with a focus on medically underserved areas and populations. And of course, we came about through Proposition 56, or our governing statute is Proposition 56, which California voters approved in 2016. This was sponsored by California Medical Association, California Hospital Association, and Service International Employees Union United Healthcare Workers West. Proposition 56 allocates $40 million of funding towards graduate medical education to sustain, retain, and expand California residency positions in primary care and emergency medicine. And the University of California is the designated recipient of the funding, as you'll see in the next slide, which is the statute language. And they contract with us at Physicians for a Healthy California to administer the GME grant program named CalMedForce. We do like to share the language of the statute. So this slide shows the section of Proposition 56 that governs our program. At the top, Part C states that $40 million will be provided to UC with the goal of increasing the number of primary care and emergency medicine physicians. The funds are used, as I mentioned, to sustain, retain, and expand graduate medical education programs. Part 1 defines primary care to include internal medicine, family medicine, obstetrics, gynecology, and pediatrics. Part 2 says that funding is to be prioritized for direct medical education costs for programs serving medically underserved areas and populations. Part 3 states that all accredited allopathic and osteopathic residency programs in California are eligible to apply. And Part 4 states that we are to conduct annual reviews of statewide physician shortages, and that funds may be used to address such shortages in other specialties. CalMedForce launched in 2018 and has awarded nearly $76 million and 350 resident positions to date all over the state of California, as you can see from our graphic here. And we're grateful to each and every one of our awardees for participating in this effort to address California's physician shortage, particularly, of course, in medically underserved communities. So thank you for your participation. And of course, we're here today to talk about the annual review, which is the end of the year reporting requirement mandated by the CalMedForce grant. So let's jump on into that. All right, starting with a quick overview. The annual review is a deliverable that documents awardees' progress in meeting CalMedForce program requirements. So we're capturing that you are, of course, meeting the requirements of the grant and also reporting about successes and impacts as well as challenges. So it consists of 3 parts. So part 1 is the cover page, part 2 is the annual program invoice, and part 3 is the program assessment. So I'm going to talk about the first part, the cover page, and then I'll turn it over to my colleagues to speak about the program invoice and the program assessment. The screenshot on the right-hand side, you can see this is going to be the first page of what you have received by email. So it will show the various parts of the annual report that we're expected for you to turn into us. We also request a couple of documents, so that'll be on this checklist as well. So we are requesting that if you have received a site visit from ACGME or any changes to your accreditation status since the beginning of the year, that you would also attach those letters in addition to the 3 parts of the annual review. So all of that is listed for you, so you can kind of use this first page as a checklist when you're gathering the documents and make sure that you have completed each of the areas of the annual review. And just as a heads up, answers will be aggregated and used for reporting purposes to our funders and stakeholders. Okay, so once again, starting at the very beginning with the cover page, you'll see this page, which is in the screenshot to the right. And on this page, we will have actually filled in these boxes for you: grant agreement number, name of the training program, name of the sponsoring institution, reporting period, payments received to date, payment year, and the length of your residency program. So what we just ask is that when you receive this from us by email, that just you check and make sure that everything is correct. It never hurts to have another set of eyes. Just make sure that everything looks perfect, the name of your training program is correct, and everything looks accurate there. Below that is the certification, where you are verifying that everything is true and correct in all parts of the annual report. So this page will require a signature and date from the authorized individual. All right, at this time, I will turn it over to my colleague, Max Hun, who will go into depth on the next part, the annual program invoice document.
Hello, thank you, Robin. So my name is Max Hun, and I will be going over the program invoice. So we have revamped the invoice to make the accounting process easier for your team and ours. So the reporting period for this invoice documents are July 1st, 2019 through June 30th, 2020. So programs must account for the awardee agreement payment, which was received during contract execution, the semi-annual review payment, which was received after the completion of the semi-annual review, and the eligible annual review payment, which will be dispersed after the completion of the annual review. This will be the disbursement model we will use moving forward. And please note, programs must account for at least 75% of their total available funds before funds will be dispersed for the annual review. So here's the revamped program invoice document. Many of you have already seen this document, as we have sent this to programs already, but we wanted to go more in depth to ensure programs understand the new process for the program invoices. So this document is meant to capture the allowable expenses incurred by programs. Additionally, the sheet will auto-calculate the remaining funds available for your program. So the next slides will go more in depth into the different sections of this program invoice. So this slide is a little bit complicated, so I'm going to try to simplify it as much as possible. Again, any questions, please ask them at the end. So this slide shows the payment calculations for your specific program. So again, the awardee agreement payment was the amount you received at contract execution. The semi-annual review payment was the amount received after the completion of the semi-annual review, and the eligible eligible annual review payment will be available once your program has completed the annual review. So please note the amount for the annual review will need to be accounted for in the invoice documents. So additionally, the previous amount claimed to date was the amount your program claimed within the invoice documents for the semi-annual review. So that line that says previous amount claimed to date, that would be from the previous invoice that you submitted for your semi-annual review. We are subtracting that from the addition of the awardee agreement payment, the semi-annual review payment, and the eligible annual review payment. The remaining funds are the total available funds with the invoice amounts subtracted. This section is auto-calculated for your program. So please make sure you have used or will use at least 75% of the funding to be eligible for the annual review payment. And this is the list of the allowable costs under the CalMedForce grant. Please note, these will be the only categories you can select from when listing your expenses. If you want more information on the allowable expenses, please see the CalMedForce grant allowable costs for the use of graduate medical education PDF attached to the annual review email sent by CalMedForce. So programs will need to account for all total available funds. So please use this section to explain why your program has not expended the funds and or what your program plans to expend the funds on. This section is important because we need to know why there are unused funds and or where the funds will be going. This section additionally will be important because programs will need to account for at least, again, 75% of the funds to be eligible for the annual review disbursement. So this slide shows the actual expense category selection process. So please note your program will be limited in the allowable expenses as explained previously. So please provide a date, a brief description, and an amount of the expenses. And I just wanted to review this section over again because it might have been lost in the shuffle of kind of looking at the individual boxes. So the total amount that you, for the expense category, so if you have faculty development and let's say you're spending $75,000, that amount will total within the box at the bottom, and then it will be subtracted from the total available funds. And that will give you the remaining funds. And the remaining funds is what you should be looking at to see if you have expended that 75% amount to be eligible for the annual review disbursement. And we wanted to expand a little bit more on the allowable costs for the invoice document. So this will include expenses like faculty development, training and education, and travel expenses directly related to graduate medical education expenses. So this is the important bit to understand. The expenses must be directly related to graduate medical education. And please note, as an addition, medical equipment has a 10% cap of all available funds for your program. Program invoice. So we've also added a new section known as the overhead costs. So the overhead costs are the administrative expenses that include expenditures for general items that support the operational needs of the GME program. And this could include things like printing, telephone, office supplies, and other administrative expenses. What this grant cannot do is this grant may not be used to support administrative costs incurred by the sponsoring institution. So it must be directly related to the general medical education program. This may constitute a maximum of up to 10% of the total CalMedForce grant amount. And then again, with a little bit of explanation about the unallowable costs. So the unallowable costs for the documents are listed within the slide, and they include things like alcoholic beverages, fundraising, information technology systems. These would be things that would not directly be related to the GME program. We wanted to note that if you wanted a full explanation of the allowable cost and the unallowable costs, please refer to the CalMedForce grant allowable costs for the use of graduate medical education attached to the annual review email. This will give you a much better, much more concise understanding of what is allowed and not allowed under our program. So now I wanted to pass the presentation on to David for the next section.
Thank you, Max. My name is David Kurt, and I'm the program analyst for CalMedForce. And so what we'll be going over together is the part 3, which is the program assessment. Now, this is divided up into 3 sections. Section 1 will be talking about program information. So we'll talk about the status of accreditation or maybe any other relevant program changes. We'll also be going into depth as section 2, which is program development and training. And so this is kind of focusing on faculty and residents. And then section 3, we want to know a little bit more about your successes and challenges for this reporting period. And so now we'll go into more depth on each of these questions that you'll find on the annual review. So question 1, that we talk about that some programs may experience changes in resident positions, and such as things like transfers, extended leaves, perhaps some other. And so if has experienced changes in residency positions, we do have a table on page 11 of the annual review document, and you can fill that out. And that will kind of look like at the box at the bottom that has the navy, resident name, NPI number, the gender, the race or ethnic category, and we do need a description of the change, and we do ask for you to be quite pointed and direct with the description of change. So in question 2, we ask you to select any changes that may have occurred to the residency program or sponsoring institution, and we can ask that you can check that all that may apply. If there are some changes that are not listed here, please state the additional changes in the space below. And so we do have changes here, such as curriculum, program organizational changes, perhaps the program is closing, or maybe there's a merger or change of ownership. Now, if nothing applies, go ahead and click not applicable, and that will be sufficient enough. In this one, we ask you, how does your program show that it has prioritized medically underserved areas and populations? And so we also ask you here to check that all apply. And so, are there hours or days of free or reduced cost services for underserved populations? Perhaps you have a curricula with a focus on underserved areas or population, or perhaps you recruit residents, faculty, and other staff from underserved areas. And if you don't find an answer here that really fits, you can always specify below by clicking the other box, and you can describe, and if you describe the more direct and pointed to answer that question, the better. And if for whatever reason, if none of it applies, you can always click not applicable. And so on the next slide, we ask you to describe any faculty development and training related to medically underserved areas and populations. And we ask for just an open text box response. And so, these may include activities that address, the social or economic climate, cultural and or linguistic barriers to health. And so we do give you a free response text box here. So the more detailed and robust the information, the better. And this question is very similar to the last one, but we're asking about resident development and training related to medically underserved areas and populations in the space provided. And so this is just pretty similar to the last question, but instead of asking about faculty, we're asking about resident here. And please go ahead and we have a response text box here, so it's open-ended. So please also provide as much detailed information as you can. And so number 6, we're gonna talk about the payer mix. And so we want you to identify the payer mix for this reporting period. So there's 2 things we're gonna ask of you. We're gonna ask for you of the payer mix percentage at the start of the fiscal year. And then we're gonna ask for you what the current payer mix percentage is right now. And for whatever reason, if they're exactly the same or you have no changes, you can always click the not change box. But that being said, even if there are no changes, it would be nice if you can fill out both boxes. And number 7, we're asking if CalMedForce funding has influenced the number of resident positions offered by the program. And so we want you to explain in the answer below. So we're asking yes, no, or maybe you're not quite certain about it. And regardless of the answer, we do want you to explain your answer below. And just like we mentioned before, please be direct and pointed in your answer, and fill it out as completely as you can. So number 8, we have, please provide the best estimate on how many patient encounters that a resident provides per day. And so we know that, each resident may touch any number of patients. So we're just asking, if it's between 1 to 5, all the way down to more than 20 per day. And we're only asking for an average here. So the best educated guess here, if you don't have an exact number, is okay. We just would like to capture it here. And so expanding on that, over the course of the reporting period, we want to know the overall average of the total number of patients served. And this is specific to the residents who are funded by the CalMedForce grant. So in your response, we're going to ask for the number of positions that were awarded by the CalMedForce grant. And then of those positions awarded, we want to know the average total number of patient encounters for all those residency positions funded by CalMedForce grant. And just like I mentioned before, if you don't have a number, a really good educated response is appropriate here. So number 10, we're really excited, and we would love for you to state the successes that the residency program experienced during this reporting period. And so this can be any number of things, and we just want you to describe them below. And the more you can fill out and the more detailed the information, the better, because we would love to share your success with others. And so the goal of CalMedForce, as we've described before, is to increase the physician pipeline in California while focusing on the medically underserved. So we would love for you to select how your program supports the growth of the physician pipeline here. We want you to just check that all apply. So, perhaps you develop new mentorship programs, you're recruiting from diverse communities, perhaps you have marketing or outreach, or even expanding upon that collateral material and assets. And for whatever reason, if those boxes don't fit, we also have an other box, and we do ask that if you describe below, please be pointed and direct in your answer. So here as well, with the successes, we do like to see what the challenges are that your residency program has experienced during this reporting period. And so, we understand that there may be several challenges that a program might experience, such as faculty recruitment changes, decreased sources of revenue, faculty and or resident well-being and or burnout, decreased patient volume at the main training site. There could be many different reasons, and for whatever reason, we didn't capture something there, we do provide another box. And in this one, it will not say please describe below, it'll say please describe on the left. So you'll notice a little text box on the left that you'll fill out your information, and you can please be detailed and as pointed to the question being asked as possible, and that should be sufficient. And so finally, being in the midst of a pandemic, we know that programs may be affected by COVID-19, and so we would like to ask how COVID-19 pandemic has affected your residency program. And we understand there might be involved less training time, less rotations, less faculty available because they may be asked on other projects or other endeavors, perhaps a reduced patient volume, reduced revenue, or perhaps other. And if there is something other, please go ahead and list that below and be as detailed as you can. And that way, our grant program can really glean insight off of this. And now I pass it over to Robin.
Thank you, David. All right, I know we have covered a lot of information so far, and so I'd just like to take a moment to summarize everything that we've covered and move towards wrapping up our presentation and addressing questions. So first, the annual review and the annual program invoice must be complete and turned in to CalMedForce to be eligible to receive the next payment. So your program will report on data for the entire 12-month period from July 1st to June 30th, which is today, unless otherwise noted. I believe there are 1 or 2 questions that ask for the past 6 months. So unless otherwise noted, you are reporting on the entire 12-month period. In the annual program invoice, we're asking that awardees account for all payments to date, as well as the next payment that your program is eligible to receive, which will be sent to you once we receive the annual review documents for the program. We are asking you to account for these future funds as well, because at this point, the contract shifts to a reimbursement model where programs essentially tell us what you've spent and your next payment is a reimbursement for those expenses. Lastly, data provided to CalMedForce in this report may be aggregated and used for reporting purposes to show our funders and stakeholders the impact of the CalMedForce funds. So that's why we're asking a lot of questions about successes, challenges, and so forth in the program assessment portion. All right, next steps. So once again, the annual review, all portions of the annual review should be turned in together. They're due on July 31st. Please submit to our email inbox specific for this report, reportscmf@phcdocs.org. This will ensure that we receive and review your report as quickly as possible. If a report is incomplete, missing items, or the program has not accounted for at least 75% of all available funds, myself or a member of our CalMedForce staff will reach out to you, to whoever is listed as your primary contact person, and we'll discuss the issue. If the report is reviewed and approved, we'll move forward with processing the next payment to your program, which is actually going to be your first payment of year 2. I also wanted to mention, I think Max mentioned this as well, we're in the process of emailing out the personalized documents to the program. We've been working very hard to put those together this week. So I believe probably about half of them are sent out already. So about half of you listening probably already have your personalized documents in your email inbox, and the other half will probably receive them today. So if you are not, if you have not received your personalized annual review documents in your primary contacts email inbox by tomorrow, please reach out to us. What that may say to me is we might have the wrong person listed as your primary contact for your program. So we definitely want to make sure that we have documents going to the right person. All right, at this time, we're open to any questions. I have not been checking the chat box, so I'm not sure what kind of questions we have, but I'll turn it over to David, who can read our questions. We also have on the line not only Max, David, and myself, but we also have Jennifer Turner, our Senior Director of Operations, and Lupe Alonso Diaz, our President and CEO. So I welcome the two of them to chime in as necessary to help us answer some questions as well. So can I turn it over to you, David?
Of course. So at this point in time, I do not see any questions or anything in the chat box.
All right, let's give folks just a minute in case anything was not clear. And in the meantime, we'll come back to questions in just a second, and we'll do a final check on questions. I just want to share our contact information while we're waiting. Once again, our website, our email address, this is our general email inbox, and our telephone number. So any questions at all, don't hesitate to reach out to us. We love to connect with our programs and help you through the process. All right, these are our staff. This is all the staff on the call today. So you can reach out to myself. Once again, I'm Robin, the CalMedForce Program Director, and you also heard from Max and David on our webinar today. And before we part ways, let's do another check for questions.
Sure, I have 2 questions. So I have one from Ms. Lau about when will this recording be available? And so I can speak to that. The recording, oh, go ahead, Robin.
Oh, sorry, David. I'm sure you could answer it as well. The recording will be available on the PHC website by the end of this week, and we also plan to email it out to our awardees as well.
Perfect. And then we have one more question. This is from Mr. Cintron. Good morning. As part of our planning, the allowable early cost report, he is talking about the 10% cap about medical equipment, and they were planning on some sim lab equipment for purchase.
I'm sorry, can you repeat that question, David?
Yeah. So he's mentioning as part of planning of their earlier planning, the allowable cost report did not mention the 10% cap for medical equipment, and they were planning on purchasing some sim lab equipment.
Yes. Do I have Lupe on the line by chance that may be able to speak to that?
Yes, thank you. Can you hear me?
Yes.
Thank you. Thank you, Robin and David, for posing the question. So as is indicated in the allowable cost document, in terms of sim lab equipment, there is a cap of 10% that is included in that allowable cost document. So unfortunately, only 10% of your grant can be used for sim lab and or other medical type of equipment. We recognize that prior documents may have been silent on it, and because this is a fairly new program, we are constantly evaluating the requirements as well as any limitations with the University of California to ensure that we are properly administering the program. So for that reason, there is more specifically an update in the new allowable cost document that does specify that 10% cap.
We do have another question in the question box, and so forgive me if I mispronounce your last name, Miss Minikal. She's asking, can you review the specifics of the page with entries for money spent? And she mentions in parentheses semi-annual and etc.
Yeah, let me see if I can answer, and please, my team, if you're able to chime in. I think she may be speaking about the payment calculations box, and if not, please correct me or reframe your question if I'm not answering that correctly. So our team will fill in the numbers, so you'll receive a personalized document with numbers filled into those boxes. So just to recap what Max said, the first box is the awardee agreement payment. That's the amount that you received at the time of contract execution. Second one is semi-annual review payment. So that's the payment that your program received upon receipt of the semi-annual review. Eligible annual review payment is the next payment that you're eligible to receive. So you have not yet received that funds yet, but we're asking that you account and tell us how you plan to spend those funds. The box after that is the previous amount claimed to date. So the number that's going to be there is the number that you accounted for in your program invoice that was turned in at the semi-annual review. So it's essentially what you've told CalMedForce that you've already spent. So that number will be directly the number that your program gave to us right after the semi-annual review. So that number is subtracted from the previous numbers. The remaining, the box under that, total available funds, that's basically the balance. That's what you need to account for in this program invoice. I hope that answers your question. If not, please feel free to let us know.
She did mention, thank you so much on that. As of now, I don't see any other questions in the questions window or in the chat window at this present time.
All right, We understand this is a little bit complex, so explaining it over a webinar is wonderful, but we understand there may be just additional questions individual to your programs, and we're happy to answer. We're available to you. So if there are no other questions at this moment, I'll have David do one last check. Any questions at this time?
No, I do not see any more questions posted.
All right, fantastic. Well, thank you all so much for attending. We appreciate your time. Please check your inboxes today for your annual program or your annual review documents. And if you have not received them by tomorrow, please reach out to our team. Let us know. We'll make sure that those documents are going to the right person. Hope you have a wonderful rest of the day. Yes.
I'm sorry, may I interrupt for just a quick second? For that particular program, and my apologies that I didn't say that up front, for that particular program that had an inquiry with respect to the allowable cost and more specifically with the sim labs, if you have additional information that you think would be important for us to know, then I encourage you to reach out to Robin so that we can better understand your situation. So my apologies for not saying that up front. Thank you.
Thank you, Lupe. We appreciate that. All right, final check for questions. And I don't think we have any more. So we will go ahead and wrap up our webinar for today, and we look forward to speaking with you all soon. Don't hesitate to reach out, and have a wonderful rest of your day.